Good afternoon to everyone. My study is about the impact of shift work. The impact of shift work on life, psychological and physical health of radiographers, a comparison between fixed and rotating shifts. Shift work constitutes a common and necessary practice in hospitals, being a consequence of the extension of work along the 24 hours of the day. It is essential to know in what measure the human organism is capable of adapting itself to efforts that can lead to exhaustion with diverse consequences on physical health, family and social life, and its capability for working. All living things have a biological clock, known as circadian rhythms, and this clock allows us to respond to the environment variations. The most evident and important circadian rhythm is the sleep-wake rhythm. Most of the clinical studies confirm the importance of a nice and regular sleep, since it can clear the brain, freeing it of information we pick up during the day. And so the timing of the solar exposure is an important variable to be considered, because the sunlight is the main synchronizer of the circadian rhythms. Shift work is necessary to ensure continuity of care in healthcare facilities, where radiographers play an increasingly key role in patient care and patient safety. The aim of this study was to analyze the influence of rotating shift work on social and domestic life and on the health of radiographers as compared to the fixed shift. This is a quantitative, cross-sectional and correlational study with an example of 102 radiographers and the combination of various instruments included in the Standard Shift Work Index questionnaire. Each one of these questionnaires evaluates a certain kind of issues. For example, the Sleep Questionnaire identifies sleep quality and sleep disorders. The General Health Questionnaire allows us to recognize minor psychiatric disorders like depression, stress, and sleep loss and problem with solving problems. Physical Health Questionnaire evaluates the most frequent cardio-intestinal and cardiovascular symptoms. And last, on scale of social and domestic life, evaluates how the shift work interferes with the type of things we would like to do in our free time. The results. Is there a correlation between socio-demographic and professional characteristics and radiographers' health and life? According to the socio-demographic characteristics, it has been stated that radiographers with higher academic degree have greater possibility of developing sleep-related disorders and lesser possibility of developing cardiovascular disorders. Another result demonstrates that radiographers who have more than one job have negative influences on social and in their family life, of course. Is there a correlation between fixed and rotating shifts? Comparing both kinds of work, in this study we can conclude that those who work on rotating shifts have superior psychological disorders, and both groups presented high values of sleep disorders, a contradiction of the majority of the studies. In conclusion, rotating shifts have consequences on the psychological health and social and domestic life of the radiographer, and it is important to regulate and implement strategies to minimize biological, physical and social impact in radiographer life to allow these professionals to keep working without significant health impairment. In order to balance the disorders felt by shift work, we should proceed to periodic evaluations, both medical and psychological, practice regular physical exercise and having a careful food health. More importantly, have a regular sleep and being able to take naps during the day, because our sleep can regulate all our other internal rhythms, And that is also why our working places should have more adequate external illumination levels, because solar light allows us to better align our internal rhythms and improve our sleep quality. There is the references and the take-home message. When we ignore or underestimate the importance of our temporal organization and of our biological rhythms, when we trust exclusively in our clocks instead of the periodical signals of our environment, when we proclaim that we can dominate nature and control time, we mutilate our body and spirit. Thank you for your attention.